Hello everybody and welcome to my channel. My name is Sara Mahfouz. I'm a pharmacist from Egypt. Today I'm gonna talk about the limitations of mammograms in detecting breast cancer in dense breast tissue. Here we go. Today, our agenda includes understanding breast density, mammogram principle, challenges in detection within dense tissue, and alternative screening technology. Finally, the implications for patients and providers. First of all, breast density refers to the proportion of fibrous and glandular tissue compared to fatty tissue in the breast. This section should cover its definition, prevalence risk factors, and how dense tissue visually differs from fatty tissue on imaging. Since dense breast tissue contains higher amounts of fibroglandular tissue, which appears white on the mammogram, this can obscure tumors, making detection more difficult compared to fatty tissue that appears dark. Dense breasts are common, especially among younger women and those with certain risk factors such as genetics, hormone replacement therapy, and lower body weight. Understanding prevalence helps identify populations needing alternative screening. On mammograms, dense tissue appears white, while fatty tissue appears dark. Because tumors also show up as white areas, dense tissue can make tumors more obscure, complicating accurate detection. This section explains the principle of mammographic imaging, the role of X-rays in visualizing breast tissue, and how mammogram results are interpreted by radiologists. Mammogram uses low-dose X-rays to create images of the breast. It relies on differences in tissue density to generate contrast that highlight abnormalities. X-rays penetrate the breast and are absorbed differently by dense and fatty tissues, allowing visualization of internal structures. Dense tissue absorbs more X-rays appearing white, which can interfere with tumor detection. Radiologists assess mammograms by looking for masses, calcifications, and asymmetries. Dense tissue can complicate interpretation, requiring careful analysis to avoid misdiagnosis. Dense breast tissue reduces mammography sensitivity and accuracy. This section discusses the difficulty in distinguishing tumors from dense tissue and the increased risk of false negatives. Dense tissue masks tumors on mammograms, decreasing the ability to detect cancer early. Sensitivity can be significantly lower for women with dense breasts compared to those with fatty tissues. Since both dense tissue and tumors appear white, differentiating between them is challenging, leading to potential misinterpretation or missed cancers during screening. False negatives, where cancer is present but not detected, are more common in dense breast tissue. This can delay diagnosis and treatment, adversely affecting patient outcomes. Given the limitations of mammograms, alternative screening options like ultrasound, magnetic resonance imaging, and emergent imaging techniques provide additional tools to improve cancer detection in dense breasts. Ultrasound uses sound waves to produce images and is effective in distinguishing solid tumors from cysts, especially in dense breast tissue. It adds value as a complementary screening tool. Magnetic resonance imaging offers high sensitivity and is recommended for women at higher risk for breast cancer or with extremely dense tissue. It provides detailed images without radiation exposure. New imaging methods like digital breast tomosynthesis, which is the 3D mammography, and molecular breast imaging are being developed to enhance detection accuracy in dense tissue. Next, a new section which focuses on the importance of patient education, updated screening guidelines for dense breasts, and personalized approaches to breast cancer detection to improve outcomes. Educating patients about breast density and its impact on screening is critical. Awareness enables informed decisions and encourages discussions about additional screening options. Screening guidelines recommend supplemental imaging for women with dense breasts. Regular mammographs combined with ultrasound or magnetic resonance imaging may improve early detection rates. A tailored screening strategy that considers individual risk factors and breast density is key. Collaboration between patients and providers ensures optimal surveillance and timely intervention. Mammograms have limitations in detecting breast cancer in dense breast tissue, which can reduce early detection effectiveness as we mentioned before. So, understanding of these challenges and utilizing alternative screening methods as we said before, along of course with patient education and personalized care is very essential to improving breast cancer diagnosis and outcomes. And here we come to the end of our session. Hoping you enjoyed it and see you next time. Having a good rest of your day. Thank you and have a wonderful day.